I'm Andy, and in this video we'll be exploring the reasons why you might want to learn dermoscopy. As a bonus, if you make it to the end of this video, I will show you a little of what's involved in being a beekeeper. Training a primary care dermoscopist for every general practice. Over the years, I have talked to many clinicians keen to learn dermoscopy, but found that while many desire, few actually attain the skill. I think the main reasons people start and then fail to learn dermoscopy is because ultimately their reason for learning isn't strong enough. They fail the why question.
I know why, Andy. Let me answer your question, please.
Good morning, Dave, or is it good night where you are? Please do tell me.
It's because I can use my new diagnostic skill to treat more patients and make more money. I can then buy that fishing boat and rod I always wanted.
Sorry to disappoint you, Dave. Learning dermoscopy isn't going to make you rich.
Well, if it doesn't bring in more dollars and will cost me time and money to learn, why do it then?
And that's the point of this video. I'm going to introduce my 3 top reasons for learning dermoscopy through my dangerous activity of beekeeping.
Struth, mate. You consider beekeeping dangerous? You should see what we have over here. Go swimming and a bull shark could take you. Go fishing and a croc could nab you. Walk on your garden lawn and a funnel web could ruin your day. As for snakes, don't even get me started.
I won't, Dave, but thanks for reminding why I've never visited you.
No worries. After a few cold ones from the esky under our blue skies, you'll forget your worries.
My first reason is you need the best tools to do your job well.
Hey Andy, I was taught the ABCD assessment for skin lesions. What's wrong with that?
Understand, Dave, that the ABCD rules are a crude measure and designed to minimise the risk of you missing a melanoma, but it overdiagnoses non-cancers as possible cancers. Let me show you a couple of patients as an example. How would you manage this octogenarian who came to show me this scalp lesion that his wife had noticed? He'd already had 2 squamous cell cancers removed from his scalp in the past. What do you think?
Well, using my ABCD, it's suspicious for a melanoma, and therefore I'd refer him on the 2-week wait on the skin cancer pathway.
Indeed, if you'd said otherwise, I'd have worried. But now let me put on my dermoscope. Look at the nice clear sharp borders. Can you see these dark brown blobs? We call them comedone-like openings. Some are larger and you might even call crypts, which are full of keratin. Also note these white dots or milia, which again are balls of keratin, and because they're higher up in the epidermis are seen more clearly on the non-polarized picture. These and other features tell me this is a pigmented seborrheic keratosis. In fact, I'm 100% sure it's benign and not a cancer, therefore I didn't refer him. How about this second one, Dave? This 66-year-old gentleman came with a 3-month history of this 12mm patch on his palm. No previous skin cancers, no history of trauma, pain, itch or bleeding. He said it kind of heals over for a bit and then would break out again. What do you make of it?
Well, it looks a bit scaly. It doesn't look like a melanoma to me. With the scale, I'd treat it first with some topical steroids or perhaps an antifungal for a patch of eczema or a fungal infection and ask him to return if it doesn't heal up. How's that for a plan?
Well, let's now put on our dermoscope. This is what you see. Note the difference between the polarized and non-polarized images. The polarized image shows up an iridescent blue-white sheen. I wish I'd used a video to show the shimmering colours properly. This is not a fungal infection or eczema. These changes fit with a possible melanoma. An excision proved it was a 3.88 melanoma. A delay of a month or 2 while you were trying different creams until the penny finally dropped could have cost him his life and delayed a referral. What would your patient think about that?
Struth, mate. Now you have really got me worried. I'll be referring everything now.
No you don't, Dave, because you are learning dermoscopy with me. Just keep joining me on these videos and you'll be fine, as will your patients. You see, as GPs on the front line of healthcare, we need the best tools for the job and to minimise under or over referrals. It's dermoscopy that will make the difference. A second reason why you might want to take up dermoscopy is that it opens up the opportunities. Did you know, Dave, there are around 25,000 beekeepers in the UK and only 2% consider themselves professional. Most started like me, as an amateur. There's a new career opportunity for me, if I wanted it.
Or when you get sacked, Andy.
Thanks for the vote of confidence, Dave. But adding that you use dermoscopy to your curriculum vitae or resume enhances it and can help any job application. You'll stand out from the crowd and have that extra skill to offer a potential employer. Do you know, it could make the difference for that plum job you want. Especially if you're considering working down under with Dave, where they have the highest rates of skin cancer in the world.
They're always welcome to Oz, mate.
Oi, don't you go pinching our medics. However, if at some stage in your career you think you might like to become a GP with an extended role in dermatology, then you'll need to start learning dermoscopy now. There are details on this role in the video description down below. The final and perhaps the most critical reason why you're going to enjoy dermoscopy is that others will appreciate your product. Patients will love your dermoscopic abilities. When they present worried that a mole is cancer, they're often losing sleep at night over the worry. 19 times out of 20, you're going to be able to give them good news quickly and send them on their way very reassured. Otherwise, what are you going to do? You're going to say, do you know what, I'm not sure. I'll refer for a second opinion. And they leave your room more worried than before, thinking, hey, if the doctor isn't sure if it's cancer, perhaps it is. When you give them the good news, I love watching their reaction. They smile, their shoulders relax, and they almost bounce out the room. How often, when someone comes worried about cancer, can you give them such quick reassurance? My neighbours love my honey. Who are your medical neighbours? It's your colleagues. Hey Andy, what do you think of this? Hey Andy, can you look at that photo? What do you think? You will become a local resource for them to tap into, and they will appreciate you all the more for it. Your hard-pressed hospital colleagues will appreciate you, although you might not get to hear about it very often, since you'll be screening out more of the benign conditions. And on referral, can now attach a dermoscopic picture as well, which will help them even more in their triage and work. My wider community love my honey. Who's our wider community? Well, it's the NHS. Do you want to save the NHS? It's easy to say it, it's easy to stand in the street and clap. But if you really want to save the NHS, then stop referring things that aren't cancer to a struggling secondary care service. You're only going to be able to do that with skin if you use a dermoscope. Like me, have you seen your routine dermatology referrals climb from a few weeks to 9 months or more for patients to be seen? Sure, blame COVID, why not? Everyone else does. But the larger part of the problem is us in primary care referring inappropriately. Ah, you say, but does dermoscopy make that much of a difference? Well, here are our local numbers. In my practice last year, because we used dermoscopy routinely, 42% of our 2-week wait referrals were cancer. If every practice in our region were to have a similar rate to us, then this is what would happen to the number of skin cancer referrals occurring in our region. Maybe then secondary care could focus on doing other work we need them to be doing. Do you want to save the NHS as well as patients? Then learn dermoscopy. Have you found your why for learning dermoscopy? If you have any other reasons for doing dermoscopy, then please put them in the comment section below. I want you to be one who not only aspires, but also attains, who enjoys the sweetness of dermoscopy and is able to share it around. Let me add this jar of honey to the shelf behind me as a reminder of the sweetness of dermoscopy. And I'm going to do it just like, and here's my summary slide for you. And then as promised, a 4-minute video outlining a little bit more about what's involved in beekeeping. Training a primary care dermoscopist for every general practice. I have 9 hives on my garage roof this autumn. I've taken our share of the honey from the bees and I'm readying them for winter, but first I need to do this. Bees can sting, so a good suit and gloves are key risk management tools. It certainly makes you stand out from the crowd. I often enjoy sitting and watching a beehive entrance, spotting bees coming back laden with pollen of colour depending on the flower they've been visiting. Guard bees greeting arrivals back at the hive, checking that bee has got the right hive. New bees zigzagging in front of the hive on their first flights to get their internal navigation system set up. Let's do an autumn check on this hive. You can consider yourself a beekeeper if you can successfully overwinter a colony. For this they need around 20 kilos of honey to eat and produce heat when it's cold and too wet to fly. It's a hobby which is challenging and stimulating, but 80% of beekeepers quit within 2 years due to the challenges. The top box is packed with these winter stores, and we actually want to check the lower ones, called blue boxes, to ensure the queen is there and laying eggs happily. This frame has lots of bees, and underneath you can see a biscuit coloured capping to cells in which worker bees are growing. These will hatch out soon. Let me blow the bees off a little so you can see the brood better. There it is. Checking the other side, I can see eggs and larvae stage as well, so there must be a queen in there somewhere. We just must find her. On this frame you can see yellow pollen being stored ready for making food to feed larvae before their cell is capped. This will be most useful in summertime when the colony expands from the current 5,000 bees to 50,000 bees in the hive during summertime. Let's put it back. So, one more frame to check. I hope we've not missed the queen. Ah, there she is. She isn't born with a red dot on her, but I put it there so finding her would be easier. She's checking empty cells to lay an egg and is surrounded by worker bees keeping her clean and well fed. I never get bored of opening a colony of bees. If you get your job right as a beekeeper, the bees reward you with lots of honey. First, however, you need to remove the fresh white wax cappings from the cells to gain access to the honey. Beeswax gives a lovely smokeless flame, ideal in medieval times to light churches and cathedrals, which is why monks kept bees. I'm sure making mead was just a happy byproduct. A honey extractor spins the honey out of the open cells from the comb. Diabetes mellitus is taken from the Greek word diabetes, meaning siphoned or to pass through, and the Latin word mellitus, meaning honey sweet. Before urine dipsticks, there was once a consultant on a ward round surrounded by his student entourage. They came to a patient with diabetes, at which the consultant dipped a finger in the patient's urine pot and proceeded to put a finger into his mouth. Sweet, he said. With varying degrees of disgust, he encouraged his students to do the same, at the end of which he said, and the second lesson for today is that if you'd been a bit more observant, you would have noticed I put my index finger in the urine and my middle finger in my mouth.
Thank you very much.
Okay, are you enjoying the honey?
I love it.
Yeah.
We use it every single day.
Really?
In the morning with my yogurt. My child loves it with his toast.
Yeah, yeah.
And you know, it's a very good quality honey. So thank you. Thank you very much.
Thank you.
Yeah.
Enjoy.
Thank you. Thank you very much.
Gracias.
Bye. Bye, Andy. Thank you.
My customers love your honey, it's tasty, it's a local product. I have lots of customers coming back for more.